guys, today we are going to be learning everything we need to know about psychosis. So during today's episode, we are going to learn what psychosis is, the warning signs before and early on in psychosis, the symptoms of a psychosis episode, causes of psychosis, treating psychosis, and how to help a loved one who might be suffering with a psychosis episode or just overall psychosis. So let's start with what is psychosis. Psychosis is a condition that affects the way your brain processes information. It causes you to lose touch with reality. You might see, hear, or believe things that aren't real. Psychosis is a symptom, not an illness. It can be triggered by a mental health illness, a physical injury or illness, substance abuse, or extreme stress or trauma. Psychosis disorder, like schizophrenia, involves psychosis that usually affects you for the first time in your late teenage years or early adulthood. Young people are especially likely to get it but doctors don't know why. Even before what doctors call the first episode of psychosis, you may show slight changes in the way you act or think. This is called the preorbital period and can last days, weeks, months, or even years. Sometimes you can lose touch with reality even when you don't have a primary psychosis illness such as schizophrenia or bipolar disorder. When this happens, it's called secondary psychosis. These episodes stem from something else like drug use or a medical condition. Whatever the reason, they tend to disappear in a short time, and they often stay away if you treat the condition that caused them. Psychosis does not suddenly start, it usually follows this pattern. So let's talk about warning signs before psychosis. It starts with gradual changes in the way you think about or understand the world. You and your family may notice that you have trouble thinking clearly or concentrating, you're suspicious or uneasy around others, you lack self-care or hygiene, you're spending more time alone than usual, you have stronger emotions than situations call for, or you have no emotions at all. Now, signs of early psychosis: you may hear, see, or taste things others don't, hang on to unusual behaviors and thoughts, pull away from your friends and family, stop taking care of yourself, or you might not be able to think clearly or to pay attention. So symptoms of a psychosis episode include hallucinations, which is hearing voices when no one is around, strange sensations or feelings you can't explain, or seeing people or things that aren't there, or you think that the space of things looks wrong. It can also include delusions, that is, beliefs that aren't in line with your culture or that don't make sense to others, like outside forces are in control of your actions and feelings, small events or comments have huge meanings, or you have special powers, or are on a special mission, or actually think you are a god. You could also have disorganized speech, thoughts, and behavior, and this can include rapidly switching between subjects when speaking, like a word salad, which is random, confused words or phrases linked together in incoherent ways, or unpredictable behaviors or antagonization. You may be wondering, well, how long does a psychosis episode last? The acute phase of psychotic episodes can vary in length, spanning a few days to a few weeks. A diagnosis of schizophrenia involves symptoms as delusions, hallucinations, and disorganized speech that last longer than a month, while brief psychotic disorder is diagnosed those symptoms that last less than a month. So let's discuss the causes that can come up with psychosis. Scientists still don't have a clear understanding of what causes psychosis. Genetic plays a role because the risks of developing schizophrenia is higher for twins and immediate relatives with the condition. But the developmental of psychosis comprises much more than one's genetic profile. It's likely due to a combination of biological, psychological, and social factors. For those who are more vulnerable to it, Psychosis can emerge during a stressful, traumatic, or other events. What triggers a psychosis episode? Psychotic episodes in some cases may be sparked by specific triggers. In addition to the underlying presence of conditions such as schizophrenia and bipolar disorders, symptoms may be provoked by anxiety, stress, alcohol or drug use, and lack of sleep. So you may be asking yourself, well, how can you treat psychosis? A single episode of psychosis, especially the first, can be controlled with medication, and a reoccurrence can often be prevented once with underlying cause is identified. To prevent further episodes, it is critical to seek treatment immediately. Symptoms of psychosis are treated with both antibiotic medication and psychotherapy. Antipsychotics can take the form of pills, liquid, or monthly injections. Hallucinations intend to subside in a couple of days and delusions in a couple of weeks, but medications require around 6 weeks to be fully effective. When individuals adhere to a treatment plan, even those who have experienced multiple psychotic episodes can manage their symptoms effectively and lead a fulfilling life. You might be wondering to yourself, is it important to treat psychosis early? And it is. Treatment is more successful when it begins right after symptoms emerge, researchers have found. One theory is that the brain changes may spread during the delay. Perhaps more intuitively, early treatment prevents young adults from missing key developmental milestones such as getting a job, going to college, or forging relationships. So let's talk about how you can help a loved one who seems to be having psychotic symptoms. Because people with psychosis have trouble telling the difference between what's real and what isn't, they often can't recognize or understand that they have these symptoms or a mental health condition at all. Commonly, they'll dismiss or resist suggestions that they can get care because they don't believe anything is wrong with them. That's why psychosis can be a source of frustration or fear for someone with these symptoms or their loved ones. If you notice a loved one showing signs of schizophrenia or a related condition, you can try to help them by doing the following. Ask how you can help. People with psychosis or conditions that involve it may talk about their symptoms without realizing they are symptoms of all of their mental health illness. Listening and communicating may help your loved one see that others care for them and want to help. You can encourage them to see someone who can help. Treatment for psychosis, especially medications, can make a big difference in a person's ability to tell what's real and what's not. Once medication takes effect, they may start to understand that they have a condition that needs care. The next thing you can do is to not judge or argue with them. People with psychosis have trouble telling what's real and what's not. To compensate for this disconnection from reality, their brain may generate things that only they can see or hear. These things will feel real, so arguing or showing them evidence isn't helpful. It's also important not to judge someone who shows these symptoms. That can make them feel even more isolated, and it may push them away from seeking help. The next thing is just to stay calm. People with psychosis symptoms can feel afraid or frustrated when others don't seem to understand or believe them. That can make them pull away from others, making them feel even more alone. Try to remain calm, reassure your loved one, and help them feel as safe as possible. Don't make them feel trapped or threatened. If there's a lot of noise nearby, try to make the environment quieter and ask if you can go somewhere more peaceful. And lastly, get help in emergencies. People with psychosis and related conditions have a much higher risk of dying by suicide. If someone with psychotic symptoms say they're thinking about harming themselves or others, or if they show severe paranoia or agitation or act abusively or violently, then you should immediately call the local emergencies for help. In the end, with any type of mental health disorder, you should always get help from friends, family members, and going further on to a doctor. Because once you seek help, once you can figure out what's going to work for you, the better life you'll be able to live. Now, there are ways to help your condition without seeking medical help, but it's when it gets to the point where you are, thinking about harming yourself or others, or getting paranoid or violent or abusive, that it's time to take that next step to reach out and ask somebody to help you so nothing happens to you or to your loved ones. So I'm hoping today that you were able to learn a little bit and understand what psychosis is and how to look for it in your loved ones that might be suffering from it, and how, again, to get them help when things are dire. I know I was able to learn more than I knew, and I think this can help shine another light on another disorder we might not have known about. So understanding psychosis and any other mental health disorder is important. So thanks for letting me chat and help you learn today about another mental health disorder, and I will talk to you guys again real soon in the next episode.